Welcome everybody to the SmartEducation Podcast. I'd like to welcome, first of all, together here with us, Jay Dicharry. Jay is a clinical researcher, also a physical therapist, and works as a biomechanical researcher. He is from the United States, and he is one of the leading guys in the United States when it comes to running and running mechanics. So welcome, Jay.
Thanks.
I suppose we can have a toast first with some good, fine Belgian beer.
I'm in.
Yeah.
Thanks, Dan.
A little drinking. Okay.
Cheers.
Ready to go.
Ready to go.
How are you?
I'm wonderful. Thanks for having me.
Yeah.
Great to be back.
Had a good trip?
Yeah, great trip.
It's not the first time we have you here with us.
No.
Yeah.
Great to be back. It's a good, awesome.
And this time for 3 days in a row.
Yep.
Yeah. So we're here to ask you some questions and to share some of your knowledge with our listeners. First of all, I wanted to know, as you are a biomechanical researcher and a running specialist, what are your thoughts on the importance of screening when we are screening a runner for injury prevention and for performance point of view? How important is that, and what can we learn from that?
Yes, I think the biggest thing is, we have athletes come in who do a lot of volume of activity, and it's easy to get lost in this whole discussion on run form versus strengthening versus everything else. And I think that having a proper screening algorithm in your head helps you really figure out critically what's the driving factors that cause things to break down to begin with. And I really think the better job we do in day one on evaluation, it gives us kind of a point of entry with that patient to say, hey, look, here's where we need to start to build a foundation up. And I think that if you do a better job, you don't miss things. And then 4 weeks down the line, when that runner is continuing to put load on the system and you're trying to fix things at the same time, you know exactly what's going on versus saying, okay, they came in with foot and ankle pain. I just looked at their foot. I didn't look at everything upstream, and I missed some things. So it's important to make sure you're looking at things comprehensively.
Yeah. Okay. And when we're talking about structural deficiencies and malalignments and those kind of things, how important is that? And do we have to address it as or identify it as a risk factor in running?
So I think that the key thing is you want to work.
We're not sure about that in research when you look at research. Sure.
Yeah. And I think that's the big difference between, you read a research study and a research study tells you an average result of a certain population, and it doesn't tell you how your individual patient is going to respond. And I think people get lost in the fact that if an athlete has, toes out or toes in or has a knee tracking, this way or that way, you have to look at how that individual's alignment is set up, because you want to work with their body as best you can. For example, if somebody has a high axis of inclination in their subtalar joint axis, they're going to have more transverse plane rotation than the quote average. If somebody has external tibial torsion, you want to have them run with their feet pointing slightly out. So if you don't understand and assess those things during evaluation, you're not treating to an average, you're treating to each individual's optimal.
That's a great point of view. And when it comes to creating an exercise program, after you did a screening, if we give exercises to runners, how do you think we're going to be successful? What are the most important things to look at? Because I know from your course last year, you are very fond of getting the basics right first.
Yeah, I think that the biggest thing is you want to build, not just muscle work, but you want to build strategies. And it's important to make sure the athlete can feel what you're doing and identify with it and reproduce it when you're with them and when you're not with them. And so if you try and get too crazy and too special and too fancy soon, you lose control. You risk further irritation to the issue, to the area that's injured, and you don't want to get buy-in because the athlete's not seeing functional transfer. We don't need to do things that look cool. We need to do things that are very specific and very optimal. So I'm a big fan of making sure we have kind of stability systems we're building within each joint, and then having those systems work together. And it's really, really critical that you select things that make sense for a patient. They can feel and go, oh, I understand why I'm doing this. And it all comes back to making sure patients are staying active and kind of being involved in their therapy versus just things done to them. And the more they feel things working correctly, the more buy-in they have and the more success and compliance you're going to have as a therapist.
Can you give us an example of a typical exercise that you are really, really fond of and you think that can make a difference when treating patients, when treating athletes?
Yeah. So, I mean, one of the biggest examples is, a lot of athletes tend to do, or we're taught, I guess, to do core work. We have to go in and do a big posterior pelvic tilt to engage the lower abdominals. And that couldn't be further than the optimal goal for an athlete, right? There's not any sport we do, we go into a big posterior tilt and then try and load as heavy as possible. And if you exercise with an incorrect strategy, you're going to perform with an incorrect strategy. And so I see this a lot, and actually in elite athletes where they've done so much core work from their coaches with a big posterior tilt on a rectus dominant sequence that, your rectus is not a postural stabilizer. It's actually a fast twitch muscle, and it fatigues. And when it fatigues, it might happen under high intensity on a speed workout. It might happen during, a half marathon or even during a 10K. When it fatigues, you lose all control. We see somebody go from kind of like anti-extension to complete collapse of their lumbar spine mechanics, and then everything just drips downstream, right? We see anterior pelvic tilt, we see inhibition of hip muscles, and we see things kind of go awry. So again, if you're going to give someone a corrective exercise, make sure the strategy that you use in the exercise is something that shows up in their sport.
So I don't think I'll ever get you caught doing learning a patient or an athlete doing a planking position.
Yeah. So I think that, if you're going to do a plank, what things do you do in sports that are isometric, right? I mean, a plank doesn't have its role to learn things.
Running is not really isometric.
Right. Running's not isometric. So, if you're going to do a plank, how about a plank with some rotation bias, a plank with some type of control challenge to really make sure athletes understand and feel things, because isometrics are great to get muscles involved, but they don't transfer to strategy. And we know that if we don't change a reflexive strategy of how we move, you're not going to get carryover that muscle strength into activity. So we have to learn through movement.
Yeah. What I've learned from you as well, there are three main things that you look at or that you try to learn to the athlete is core control or posture control, then the contralateral rotation, and also hip drive. What about that last one? How important is that in propulsion and in towards performance as well?
Yeah, huge. I mean, I think, let's face it, the vast majority of runners we see have one main problem. They all tend to overstride, right? And so I think most individuals who aren't trained, and by trained, I mean working with someone who's given them a program, tend to be very quad dominant. And so the way you move is the way you run. And so your athletes who tend to be quad dominant, they love to use their quad muscles. They tend to overstride with much more loads than knee muscles. And we have this never-ending cycle. And we wonder why the highest incidence of injury is patellofemoral pain, right? So, it's important to make sure that we're building a nice symmetric strategy. Further, when you put the knee forward, you not only do you overload the quad, but you overload the knee, but you also don't get control, right? The hip muscles are nice because, yes, they're involved in propulsion, but they also control steering mechanics for the lower quarter, and they also have a big role in posture, like you talked about. So we're trying to create a strategy of movement, and, knee muscles are nice. You have to have them too, but they're pretty much single plane, and hip muscles act in multiple planes, and they have a big function in stability and as far as drive for efficiency. So it's really important to make sure that we can get things to work together. Yeah,
really good. Talking about rehab now, all those pathologies. I'm sure me, myself, you, all the listeners here, we all see the same common running-related injuries coming in the waiting room. And we try to get them better. In your experience now, what is the pathology that you don't like to seeing coming in? Or in other words, which one is more difficult to treat, and why is that?
Yeah, I think the biggest pain to treat, literally, is someone with Achilles tendinopathy coupled with retrocalcaneal bursitis. Okay. So now you've got two things going on. You've got an acute inflammatory condition right in the heel. Those patients literally can't tolerate pressure across the heel bursa at all, plus the fact they're limping, plus the fact you have to work on some load for the tendon. It's really hard to find a point of entry with those folks. You've got to calm things down, and you have to work on strengthening things. And we know that tendons don't do well with rest, right? They actually get weaker and break down, and you have to load a tendon. But it's hard to do that when you've got a combination of, local irritable surface irritation from the bursa. So
you want them to continue running, but that won't be good for the bursitis.
Right. Yeah. So you have to sort of play this game of trying to calm things down. That can be very frustrating at first. Now the good news is once the bursal irritation calms down, then you can get back into a formal plan for the tendon. And I think the biggest knock on runners is that, they want the quick fix for Achilles tendinopathy. And I tell people with tendon pain, we'll get you better. I have no doubt this will resolve. we have to think in terms of months, not days, right? It takes a while for the body to actually remodel and to get better, and that will happen. You have to load a tendon properly, but if you've got the inflammatory condition on top, it's tough.
Okay. While we're busy on sharing knowledge, maybe it's a good idea to debunk some myths that are still out there in running that we see coming across in all kind of media. First of all, how about cadence? Cadence, should we all try to strive for the plus 180 strides per minute?
Well, I read in the magazine, so it must be true, right?
Yeah, of course. If Runners World said so.
Yeah, it must be true. So I think that's a great question. And, you can look at this two ways. One, from a scientific perspective, I think, again, most runners overstride, and quantitatively decreasing your overstride will bring the knee joint closer to the body, and we can decrease knee loads by about 5 to 20% just by increasing cadence. Now, that being said, that doesn't mean you have to go from 155 to 180. The research shows that that's actually very hard to maintain because it's very physiologically taxing for the patient to try and turn the legs over that quickly. That's one thing. And then from the non-scientific side, if you look at what's played out over real world, world records have been broken between 172 and 212. So you have a pretty wide range there of what works. Yeah. And just because you can run 180 steps per minute or 200 or 179 doesn't mean that you're going to win a gold medal either, right? So I think that, looking at your turnover is a very effective strategy. And I always tell folks, if you're running, an easy pace with a pretty low cadence in the 150s and low 160s, it's probably worthwhile to start to bump up that patient's cadence rate. But there is no holy grail to hit, right? No. And so cadence rate is tremendously individual based upon your body weight, your speed, your soft tissue density. You have Titan, the structure of our cells. That's very individual specific DNA, right? And so different people have stiffer systems, at different cadences than people with less stiff symptoms. And that's fine, right? Yeah. So there's some variability there. I think that as long as you're within a window of, low 170s to mid 170s for easier runs, and as that speed increases, that cadence is going to increase too. Yeah. So it's important to look at, but it's not the only factor.
No. In my opinion, it's always possible to ask your runner to increase your step rate by 5 or 10%. Right. Not looking at numbers and going for the 180 because the books are telling you so, the magazine is telling you so, but work with individual percentage.
Yeah.
And give them time to adapt.
Right. And the biggest thing too is not just shortening the overstride, but also working on getting propulsion out the backside. I think one of the discussion on cadence has led runners to just taking a bunch of short, choppy steps. And that's definitely better to improve joint stress, but our economy suffers. So, I always tell folks, you're striving for a tight swing of your pendulum. When you think about the front to back swing of your leg, you want to have your leg contact close to your body. And if it's overstride, sure, cadence is a tool to increase percentage, but you want to bring things in. That comes from strategy more than just a number.
From contact on the ground to foot strike, that's another myth. Should we all go for the 4-foot strike?
Yeah, great question. Again, I read that in Runners World too, so I guess I should. Born to run. Yeah. So, again, very few things hold true always for everyone. And I think that in my research, I've seen that it's okay to have a 4-foot, a midfoot, or a rear foot strike. I don't really cue foot strikes. People have preferences there, and it's really hard to change that. And your foot strike pattern changes with differences in speed and different surfaces and different uphills, downhills, etc. So I don't cue a foot strike, but the key thing is to have the foot to land as close to your body as you can for a given speed. So if you're contacting in your 4-foot, midfoot, or rear foot out in front of you too far, that's not going to be the best thing. If you're contacting close to you on a rear foot, midfoot, or 4-foot, I'm much happier.
Okay. That's very clear. Yeah. Maybe a last one.
Yep.
Okay. How about shoes? That's another subject. I still remember you saying once, and I find it a very nice phrase, shoes are tools. What do you mean by that?
Yeah, so I think people have this idea that, they come in with a bunch of broken down stuff in their chassis and they basically put a shoe on and things fixed. And it's not, right? So
Easy.
Yeah, I wish. The reality is if you call a plumber over, they have a bunch of tools, right? But they have to know what to do, right? So a shoe is a tool to help you run. But if you don't know how to operate your body in terms of posture mechanics, hip drive, proper foot function, etc., that shoe can, it may bump you over a percentage point or two in terms of help, but you need to actually show up ready to rock. And I think it's a big thing is we try and prepare runners for the stresses they're going to have. Running's hard. Running puts a lot of stress on our body, and if we show up prepared, our runners do really well. I think part of our job is to try and help do that, prepare runners for success.
Yeah. That's great. I think that's a good conclusion.
Good.
Time to wrap it up.
And have another sip of beer.
You want to sip that beer? Yeah, of course. We cannot get too warm because otherwise that would be a big waste.
That's right.
Okay. Thank you for being with us. I hope all our listeners have something. Will take something home from it. We will be here tomorrow again, and then we will talk all about the foot, but that's another course. I wish you all the best with your book as well.
Thank you.
I have to mention this, that Anatomy for Runners, the one that came before the Running Rewired book, I like a little bit more than the one, because maybe it was because it was the first. But on the other hand, the Running Rewired book gives you a lot of, I think it's 15 programs working on strength training. I can recommend it to everybody working with runners as a physio, and also for trainers to have a better idea and understanding of how running really works biomechanically.
Awesome.
So, Jay,
Yep, appreciate it.
see you back next year.
We'll be here.
Of course.
Thanks guys.